Thank you. All right, now we'll start our first round of questionings with 7-minute questions and answers with Dr. Eyolfson.
Thank you all for coming. Mr. Howlett, I was wondering if you could sometime in the near future provide the source of some of your information regarding Colorado. We have a correspondence from the Attorney Generals of both Colorado and Washington State regarding impaired driving and also the use among youth. And they tend to indicate the opposite of what you have said in this, that certainly with driving, the initial spike appeared to be due to improved detection methods that didn't exist before, and that the effect of use of youth actually after legalization has pretty much plateaued at what was the national average. So it seems in contradiction to what you're saying there.
Would you like a response now, Mr. Eyolfson?
Very, very quickly, yes. I have limited time, but yes.
Mr. Eyolfson, the data comes from the impact study compiled by the Rocky Mountain High Intensity Drug Trafficking Area Study.
Mm-hmm.
And that is...
And what was the organization that performed that study?
That is referred to in several papers, both by Harold Callant.
Mm-hmm.
I'll send you the exact reference.
Thank you. If you could send the references, that would be great. Thank you. Thank you. All right. Yeah, Mr. Bernstein, I appreciated your comment about young people. I mean, we agree. We do not want young people consuming cannabis. We know that, as you say, it affects the developing brain, and as well, Dr. Grant is saying, I echo those sentiments as well. We need to restrict this because we know it's harmful. I think we also need to, particularly appreciated the comment that we have to find out if young people are smoking a lot. The first question we have to ask is, why? I practiced medicine for 20 years, and, we do see changes in young people that do smoke it, or consume cannabis. On more than one occasion, I've diagnosed schizophrenia where it was very clear that the onset of psychotic symptoms predated the use of cannabis. Young people were self-medicating with it because they didn't want to talk about their symptoms with anybody. They started hearing voices and felt better when they smoked cannabis. That's not the whole story, but you're right. I think by a more open dialogue about these things, we have to ask these people, not just young people, if anyone is consuming a lot of a substance, the first thing we have to ask is, why? So I think that's very, very important. So Dr. Grant, in your brief, you said that, and in your statements here, that you recommended aligning it with alcohol, the legal age, with the legal age for alcohol. Knowing what you know about adolescent behavior and patterns, mm-hmm. Speculate, if you will, what would be the result if we had put the minimum age at 21 or 25, as recommended by the Canadian Medical Association?
Well, I guess the point that I was trying to make, thank you for the question, was that we already know that Canada's youth are experimenting with cannabis at a rate of about 30%, depending on what age. But by 15 years of age, 30% of Canadian youth will have already used or will have used cannabis in the last year. Mm-hmm. The reason that the Canadian Paediatric Society has said we must align the age of legalization for cannabis with other controlled substances like alcohol is that they're going to keep using. So mm-hmm. setting the age at 21 isn't going to sort of magically reverse those numbers. And we then get into a situation where we're looking at what's the balance of harms and benefits. So if we put the age higher at 21 or 25, we are concerned that then we've got all these youth and young adults up to 21 or 25 who don't have access, should they choose to experiment, which we don't recommend, to regulated product with known concentration. So, so that's our concern. We don't recommend it. We know they're experimenting. It should be the same as alcohol and cigarettes.
All right, thank you for that. Now, you also wrote about public education campaigns, and that this has to be part of it. And again, we agree that C-45 has to include robust public education, particularly directed towards our young people. We've seen public education campaigns in the past that were, to say charitably, were a little clumsy. I think we can all remember laughing at the ad with the fried egg on the pan, your brain on drugs. We know that in fact just did not resonate with anybody as an effective way of deterring. What elements like what would be the most effective way of transmitting this to young people, that this is something they shouldn't be doing?
So it's getting a little bit outside my area of expertise, to be honest, but I guess a couple important points, which I mentioned in my brief: partnering with youth leaders, partnering with public health agencies, having messages, clear messages, in preparation for what's going to happen should this go through next summer, and not just sort of last minute, and making sure that there's adequate investment, right, of getting the word out. Because I agree with with Peter Howlett and also Ian Colbert in terms of there needs to be more of a conversation. There's lots of myths around cannabis use for youth. You ask youth, like we often do as pediatricians and adolescent medicine specialists in our offices, they're getting lots of information from like cannabis YouTube channel and different lobby groups, but there's not any kind of there's not clear messages around what are the risks. So, 1 in 6 will develop a cannabis use disorder. There's actually structural and functional changes on MRI related to cannabis use. Those messages aren't out there.
All right, thank you. How much time do I have? None. All right, thank you very much.
Okay.